maybe 2 weeks ago, I got really, really sick. My sugar got really high, and the only thing that I could do was go to the emergency room. It took me hours to actually talk myself into, you have to go. And the only thing holding me back was I cannot afford an emergency bill.
SALINA Cummings needs medication to control her type 1 diabetes and shingles. And although her workplace offers it, she has no health insurance.
I feel like Bagel Grove is my family. I've worked there 15 years this month. But the health insurance right now, what Bagel Grove offers, wouldn't benefit me anything.
Health insurance, 6% payroll. People talk about a good job. It's a job they like going to. It's a job that pays reasonable for the amount of work they're putting in, and a job with benefits. As an employer, I want to offer that kind of job, and I don't know that that's doable in this sector. Tiny little bagel shop, but.
Companies like Bagel Grove are in the minority among small businesses. The 20-employee shop took advantage of both a tax incentive and a special program under the Affordable Care Act to get more employees covered. That's been one of the goals of the new healthcare law, since companies like this one employ nearly 34 million American workers.
We always offered health insurance here. It was really expensive, so not every employee would buy into it, but it was always an option. When the ACA came through, we could offer health insurance for cheaper, and more employees said, yeah.
I got the insurance through Bagel Grove as soon as it was possible. What you get is the preventative exam included once per year, and then after that, it's a high deductible plan. I mean, I am rather young and healthy at this point, so this is when health costs aren't a burden on you.
I don't go home at night and go, oh, I'm taking care of all my employees and they have access to the best health care out there. And no, it's not true. Because it's so expensive, I can only offer a very minimal plan.
I don't get the insurance through work. I don't want to pay into something that's only going to offer me one checkup a year when my kids still have nothing.
It's $20 a paycheck for myself, and it's over $200 a month. If I were to add my son to my insurance, I would have to pay for prescriptions, a doctor's fee, co-pays. I'd have to pay it all.
While some small business employees have turned to the individual state exchanges, at Bagel Grove, a few had relied on Medicaid as their health insurance alternative.
And I just found out they've been told they make too much money, which is crazy to me.
I make between $250 to $350 a week, and that's too much. My son still qualifies for Medicaid. I think he has about 4 more months left, and then he's getting cut off of insurance as well. I considered stopping working and just getting some Medicaid again, just so I could get myself back on track. But I don't like the way you feel and the way people look at you when you say, oh, I'm not working.
Yeah, great. Obamacare allowed us to offer a certain kind of health insurance to more employees, but health care is so expensive that it's not really fixing the problem. It's not making it so that if you're sick, you can get that taken care of and go on with your life.
I need my medication. It is sitting right there at the pharmacy that I drive by every day. When I get my paychecks, I'm just like, maybe this is the paycheck that I can just get one of them. But that never happens.